Right, how you doing? I just thought it's probably about time to do this video. Sorry about the dog barking in the background. This isn't a rant at all. This is more to try and make people understand more about me before they judge. It's came to my attention for years, which I didn't really care about, to be honest, about what people say about me, maybe not well all the time, being off work. And the comments are always coming back to me because I have plenty of friends. I don't think I have any enemies because I don't feel the need to treat somebody bad enough to have enemies. It always comes to me when people come back and say, Stevie's off all the time because all that shit he takes with the bodybuilding. He needs to give that shit up, needs to give this up. For all of you that don't know, I actually suffer from cystic fibrosis. I'm diabetic because of my cystic fibrosis. My pancreas doesn't work because of cystic fibrosis. I have liver cirrhosis because of cystic fibrosis. And the lungs are affected because of cystic fibrosis. Now, you can go into Google and type in cystic fibrosis and that will tell you people with cystic fibrosis do not have a long life expectancy. That is including myself. I'm 33 now. And I have well past what they expected me to live beyond. My mum and dad grew up wondering if I was going to make it as a baby, make it to my teens. As I was a youngster, I was told I probably wouldn't make it to my teens and I need to look after myself. As I got to my teens, I was told I wouldn't make it to my 20s. Well, when I hit 20 years old, I started thinking, you know what, I don't want to believe this. So I looked into a few things. I looked into treatments that were given in different countries, apart from here, because in other countries you pay for your treatment. And I decided, you know what, I'm going to start bodybuilding. I was so skinny that it got to the stage where I was going to be getting fed through a drip through my nose because my malnutrition was so bad. Now, I'm going to put up a poster that gives you various symptoms and things that go wrong with the body with people with cystic fibrosis. One of them is malabsorption. One of them is growth failure. One of the major things in cystic fibrosis is people with this condition are born with little to no testosterone. Now, in a male, testosterone is very, very important. The reason being is, excuse me, it is responsible for your organs growing, your lungs, your liver, your kidney, your pancreas, bones. The bones can bend, called clubbing with people with cystic fibrosis. All these things. Now in this country, they don't seem to give you testosterone therapy. They will not prescribe it. In America, I have a friend I have become quite acquainted with who is a bodybuilder and has cystic fibrosis. He's doing very well and he gets hormone replacement therapy. Now, I started bodybuilding and for the good first few years, right up until before I competed, I did not touch anything in relation to testosterone. I was determined to do it on my own. Now, my lungs weren't as good back then. I was getting lots of chest infections. I still get them now. I had developed liver disease already from the age of 18, and that a lot of this is down to there been little testosterone in the body and these organs are just not developing correctly, and this is why people die young. It's like the engine in a car. If that engine's fucked, the car's not going to go anywhere, it's not going to last long, it's not going to have a long life expectancy, just like people with CF. Now, people with CF, if they have testosterone in their body, their organs are going to grow. They're going to grow to the potential, not quite, but to a normal human being who doesn't have any health problems, right? I mean, I've known guys with cystic fibrosis that died when they were teens. They were at my school. Okay? I was lucky. I hung on. I decided to do my first bodybuilding competition and I did sample with testosterone therapy and taking the anabolic steroids, as they're called, which the media blows them way out of proportion because they are prescribed medication. Now, since I have taken this, my lungs have developed, my pancreas has hung on in there, it doesn't produce enzymes, it just doesn't produce insulin, but it's hanging in there, and it's doing the job as long as I take my medication. I take over 140 tablets a day, up to 9 injections a day. Alright? People look at me and think, oh, Stevie just takes all this shit and, you know, and he's into the roids and this, that, and the next thing. My main reason for getting into bodybuilding was because of my health. It was battling my health, and I was going to prove the doctors wrong that I was going to live. And I'm still here to this day. You know, and I'm at the age now where people will be thinking, I don't have long to go, right? I'm determined to keep going. But if you look into Google, you'll see anyone with cystic fibrosis does not make it much further than I have at the moment. My lungs are sitting, because of bodybuilding and because of the therapy and the testosterone I have been taking myself, at 120%. Now, I would bet my house that any other average person and go and get their lungs tested, their lungs will not be over 100%. Mine's at 120. There's a chart that the cystic fibrosis team use, and it's bad to super normal. Sounds kind of cheesy, but I'm at super normal with my lungs. They're better than someone without cystic fibrosis. Okay? When the CF team met me in Glasgow, they couldn't believe their eyes, they couldn't believe my records, and immediately they took pictures of me, asked me what I did every day, and they now parade these pictures in my story around about Britain, saying that this is maybe the direction we need to take cystic fibrosis patients with. You know, put them on this direction, you know, because at the end of the day, when you're told all your young life you're not going to be here for long, my mentality was, well, if I'm not going to be here for long, I want to do something while I'm here, and I want to enjoy it. So I took that risk in doing it. Thankfully for me, it's worked so far. I'm not saying I'm going to live to 80, 90 years old, but I'm healthier than anybody else I've ever met with cystic fibrosis, and I'm very grateful for that. You know, people, my friends come back to me and say, oh, folk were asking how you were, and you know, I'm off work just now, I'm going to be off work long term. I just need more time to concentrate on my health. I need to check my blood sugars every half hour. Because the pancreas does not produce creon, the enzymes, I have to take the creon tablets. Sometimes they don't work, but I've still got to take my insulin when I eat. If these tablets don't work and I'm bloated and my food's not digesting, I go into low blood sugar, okay? I have to eat every 2 hours. If I don't, I start getting dizzy. I can't function straight because the tablets only absorb so much of the nutrients out of the food. I don't absorb I'd be lucky if I absorb half the nutrients out of food that a normal person does, and I'm still able to push myself and go to the gym and build muscle that people with nothing fighting against them can do, right? And I'm not blowing my own horn here. I'm just wanting people to understand that I'm not just this guy that takes pills and injects this and takes that and, you know, he needs to give up all that shit he's taking, that's what's making him well. Yous don't understand. I've surpassed my life expectancy due to what I have done, and I've had many doctors tell me this. If I was living in America, I'd be getting prescribed this stuff, and I would be taking it anyway. I decided to go down that route myself. I took it off my own back. What did I have to lose? I told I was not going to be here for long. My parents went through hell wondering how long they were going to have their son for. You know, so I think people really need to look into things before they judge a book by its cover. You can say what you want about me. To me, I think it's just jealousy. Not that I'm saying I'm anything special, but just Google cystic fibrosis and look at all the things that are going against these people with CF. You know, I know a lot of people with cystic fibrosis. We've been up in Glasgow getting my checkups, and I feel so sorry for them because they are not as lucky as I am, because they were not given the knowledge. And, you know, I've been surrounded by great people and bodybuilders. You know, a few of my close friends have been a big inspiration in my life and my personal heroes. And I thought, you know, I want to do that. I want to do that. And I thought, I'm going to do it. Some doctors will say, don't push yourself, don't strain yourself, blah, blah, blah. I thought, no, because if I get wrapped up in cotton wool, I'm just going to go downhill like every other person with CF. You know, and I feel so sorry for people that haven't been given that motivation to try something different, because at the end of the day, if you're told you're not going to be here for long, what have you got to lose? Honestly. Now, I have medication for my liver, which I've had since I was 18, before I even stepped into a gym. So for all those people saying, you know, I guess I'm saying this for when maybe my health does go bad and I'm not here anymore. I have liver cirrhosis due to cystic fibrosis. Liver cirrhosis is one of the things that kills people with cystic fibrosis. Another thing that kills people with cystic fibrosis is the lungs. Mine's at 120% because of what I've been doing, and because I took that testosterone to allow them to fully grow and be functional. Okay, other CF people in this country have not had that. Their lungs have not developed correctly, organs have not developed correctly, and they basically die in their own mucus. They drown in their own mucus. Okay. The pancreas is another thing. I mean, without my medication, I could not digest food. 6 feet at 20 years old, 6 feet I am, and I was 10 stone 2. 6 feet. So I started eating and training like a bodybuilder. I was eating every 2 hours. And within 8 months, I went to 13.5 stone. Okay? I got all the way up to 17.5 stone, and I decided I wanted to compete. And at that point, I'd been reading into medication I could get if I was in a different country. So I got it and I decided to take it. And I'll tell you, I'll never look back, because I wouldn't be here anyway. People need to look into this word, steroids. People go, oh, right, you just don't realise this is prescribed medication, right? This is prescribed. That's all it is. It's not ecstasy, it's not heroin, it's not something that you get a high off of. It's prescribed medication. It's like getting thyroid medication. It's like taking aspirin if you're to thin your blood, okay? It's like antidepressants if you have low moods. I do not produce testosterone on my own, so I will continue to do what I am doing. And for people that think I take monstrous amounts and never come off, you know, he's never off them, I can't afford to do that. I have liver problems. If I was